How to prevent preterm birth. Preterm birth is defined as birth occurring after 20 weeks and before 37 weeks. There are lots of ways to prevent preterm birth, such as smoking cessation, prenatal care, and a healthy diet. Preterm birth is a very serious and dangerous outcome for pregnant mothers to have to face. Some of the methods used in this research were randomized testing, clinical trials, and interviews. Some of the results included improvement, better care and overall health, or things like respiratory distress syndrome and even neonatal death. There were 4 studies evaluated. The first study was by Van Mathy called A Qualitative Knowledge Assessment of Pregnant Women on Preterm Birth in a Tertiary Care Hospital. The second one was by Goldrich called Antenatal Corticosteroids for Accelerating Fetal Lung Maturation for Women at Risk of Preterm Birth Review. The third, by Silva, is called Preterm Birth Risk, Me, Women Risk Perception About Premature Delivery, a Qualitative Analysis. And the fourth one was called Pregnancy and Opportunity to Return to a Healthy Lifestyle, a Qualitative Study. The purpose of the study conducted by Van Mathy was to assess the knowledge of pregnant women between 6 and 8 months of preterm birth, and also to evaluate the demographic characteristics of the preterm mothers and their infants. The study also aimed to help provide health education during antenatal visits in the hospital, prenatal wards, and outpatient clinics to benefit, and helping lower rates of neonatal mortality and illness. The purpose of the study by McGoldrick was to assess the effects of administering a course of corticosteroids to women prior to anticipated preterm birth. The study considered things like blood pressure, glucose intolerance, dyslipidemia, and hypothalamus pituitary adrenal axis function in adolescents and as an adult. The purpose of the study by Silva aimed to understand how pregnant women identified as being at risk for premature birth, perceived that risk, and to explore the strategies for improving the care and outcomes for those pregnancies. Premature birth is one of the main causes of morbid mortality. A diagnosis that is being at high risk for premature birth can diminish a pregnant woman's quality of life, which is what the study aimed to help understand and prevent. The purpose of the last study was to investigate the lifestyles of participants during their pregnancy and what contributes to it. Most of the pregnant women expressed a desire to be more physically active and adopt healthier lifestyles. Healthy habits can be associated with lowering of hypertension and postpartum depression and other things such as increasing positive maternal and neonatal outcomes. The study by Van Mathy was a prospective observational study. It consisted of 250 random pregnant women over a period of 6 months. These women were given a preterm knowledge assessment that consisted of a standard set of questions. These women were followed up. The questions they were asked included things like patient case records, medication charts, lab reports, mother's file, antenatal cards, and direct interviews of the pregnant women. The methods in this study used randomized controlled trials, cluster randomized trials, and quasi-randomized trials to test the theory. Participants in this trial were women anticipating delivery before 37 weeks as a result of spontaneous preterm labor, rupture in the membrane, or planned preterm delivery. The trial looked at corticosteroids or placebos and observed the effects they had on the women. The methods of the study by Silva were used to identify the risk for preterm birth in pregnant women who were involved in randomized controlled trials. This trial involved 963 pregnant women who were at higher risk for preterm birth. All of the participants were between weeks 18 and 22 of gestational age. The women, when given a survey, explored their comprehension of the trial's risks, their personal experiences, the explanations provided to them, and their understanding of prematurity regarding the trial. Out of 391 women contacted, 153 could not be reached, 22 would not participate, but 216 women agreed. In total, 208 women completed the interview. The method used in this study consisted of all women who were either pregnant or had recently given birth in Bushehr, Iran. The participants were women who were 6 to 10 hours postpartum or in their third trimester of pregnancy and that spoke the Farsi language. 90 women were found for this study, and 60 out of those 90 women were eligible to participate. The women were then interviewed, and the questions were not the same for all of the women who participated. Each interview lasted 30 minutes to an hour and were audio taped. The researchers then took the interviews, made notes based off of the answers given. They then used software used to analyze the data from the study. The results of the study by Van Mathy was that 20 out of the 220 women ended up having preterm births. 175 women came to full term, and 25 were under follow-up. Some of the characteristics used in the study were age, antenatal care, education level, area of residence, occupation of the mother, respiratory distress in babies, mode of delivery, pregnancy outcome, parity distribution, and weight of the babies. Here are some more of the results of that study. Results from the study by McGoldrick include perinatal death, neonatal death, fetal death, respiratory distress syndrome, chronic lung disease, intraventricular hemorrhage, maternal death, endometriosis, or neurodevelopmental disability. It was found that the risk of RDS compared to the placebo is reduced with antenatal corticosteroids. The study found that respiratory morbidity is a serious complication that causes mortality and disability in preterm infants. The results from the study of Silva included participants who stated their understanding of the trial and its associated risks. Some of the participants experienced miscarriages, stillbirths, premature birth, or death in previous pregnancies, but overall, patients considered that the results of the treatment had a positive outcome. Most participants stated that the treatment kept the baby in until it was an appropriate time, and others say that it worked because they can hold their baby in their arms, and compared to this treatment outcomes of their other previous pregnancies. While there were good outcomes, a lot of participants reported neonatal death or stillbirth as a result of this trial. The results of this study concluded that most women who were pregnant decided to make positive lifestyle changes. Some of these lifestyle changes include modifying their diet, their sleep patterns, their sexual relationships, and other bad habits. Most of the participants live a healthier lifestyle than before by keeping up with fitness. When Nurse Vivian Brown was interviewed, she was asked, "What have you done or seen done in your field to help prevent preterm birth?" She quoted, "Good prenatal care is the main thing to prevent preterm labor." She also said that it was important that the expectant mothers are able to get to their appointments and that they have the transportation needed and all of the paperwork and everything needed to get to their appointment. And lastly, she said it was important that they are very educated on the subject of preterm birth and what to do to prevent it.